presentation is being recorded and should last approximately 20 minutes. The presentation will be followed by a question and answer session after the presentation is concluded, but feel free to ask questions by typing them into the chat window at any time. A downloadable version of this presentation will be made available on the TLC website, and if you have any questions that we weren't able to address this evening, please feel free to contact TLC Eye Care directly. On behalf of TLC, I'd like to thank you for attending, and now I will turn this over to Dr. Purohit. Dr. Purohit, whenever you're ready.
Thank you. My name is Dr. Purohit, and I've been with TLC Eye Care Laser Centers for several years. I do perform cataract surgery in all respects, but I must say this is one of the most exciting advances in the field we have seen in years. And so with that, I will begin. Our discussion tonight will include such topics as what is a cataract and how it affects our vision, what is the difference really between LenSx and traditional cataract surgery, the benefits of having LenSx versus your traditional surgery, how to choose the lens options for customized vision, and lastly, what is the general insurance coverage and out-of-pocket costs. So a cataract is essentially a clouding of vision that occurs generally as we age. There are conditions where that is not the case, but usually everyone over the age of 50 starts to have some clouding of the lens. And what's interesting is that this clouding or impairment of vision can actually lead to problems such as the article here, which says that can actually having cataract surgery done will reduce the hip fracture risk. So now we're actually seeing benefits to health in having cataracts taken out and being able to better perform visually. So previously it was just, we have better vision, we can function, but now it's actually reducing risks of serious falls and fractures. Cataracts really are highly treatable. In the United States, really over 2 million cataract surgeries are performed, and our group alone in Michigan does over 3,000 a year. The cataracts do damage vision in the eye because the clouding of the lens does not allow light to enter as a single beam onto the retina. So it reflects off, and that's why you can have symptoms such as glare and loss of depth perception. Really, the cataract, the lens of the eye, really focuses light onto the retina in a very similar way that a camera will focus light onto film. But these are some pictures of how a cataract can cloud up the vision. So now we move into what LenSx is. Traditionally, we've been doing ultrasonic, cataract surgery for years now, and we've had a lot of success. And now we have this technology available to us that really is going to revolutionize the field, because the surgeon in traditional surgery has to make the incisions, remove the cataract by breaking it into pieces manually, and then finally implanting the lens. And that's not even taking into account if you have a football-shaped eye and have to dial in a certain prescription. What we're seeing with LenSx now is femtosecond laser technology that is able to actually provide a surgeon with real-time video imaging and a three-dimensional visualization of the entire cataract. And so we're able to emulsify that cataract using the technology, as well as make our incisions and correct astigmatism, or that football shape to the eye, all at the same time. This, by the way, is FDA-approved technology. There are different methods of performing cataract surgery, but one step is very much the same, and that is getting access or entry into the cataract. So you cannot take the cataract out unless you've created an open space or open the door to take the contents out. And that opening is actually called a capsulorhexis. It's a long, big word, but the bottom line is you're making a circular opening or a circular door, if you will, or a window that you can then climb into and get all the material that's in there out. And the real beauty of this technology is that we are actually able to make that circular opening with such precision that even the best of us, I'd like to say I do a wonderful manual circular incision to get into that eye, but this technology is blowing away even what I thought I could do. And when you look at this busy slide, it essentially is saying that human error exists, but the precision with which the LenSx works is just phenomenal. The purple line is the LenSx, and you consistently are getting the most beautiful round opening to get into that cataract time and time again. And people say, well, why does that make a difference? It will make a difference, as we will see in a few slides. So what does the LenSx do? We're going to soften the cataract so that we have easier removal and less trauma to the eye. We're going to help that football shape of the eye that we talked about, or what's called corneal astigmatism, by reshaping the eye using the laser. And then we can also make the little cuts that we need to get into the eye with the laser, and it just positions everything just perfectly. When we've made that beautiful opening with the laser, the lens placement is so optimal. It's perfect every time because it's captured really nicely underneath a perfectly circular opening. People ask me in my clinical practice all the time, well, doctor, we know that one of our lenses is covered by the insurance when we get cataract surgery, but what are these other lenses that we saw in your video? There are a host and a variety of lenses that can be placed into the eye. So when the cataract or that cloudy lens comes out, we must put something back in so that you can see again. And that lens that we put back in is an artificial lens that will stay in for the remainder of your years. People ask, do I have to change it out? Do I have to do something with it? No, that's a lens that stays with you. So there are different choices. Some of them are listed here. You can have a monofocal lens that gives you a single focal point of excellent vision. Most of my patients do choose distance. I have had a few of my accountants or other patients who really want to see up close all the time, so I've set their vision to see very well up close. The Restore lens is a multifocal lens that provides vision at both far and near, and a good range in between. You are less dependent on glasses with this type of lens. Hello? Is there a question? Hello? And the toric lens, I apologize for that. The toric lens is the lens that's going to help correct both cataracts and astigmatism at the time of surgery. And what that means is that you also will be less dependent upon your glasses. There are costs involved with cataract surgery, as with any surgery, but most insurances and Medicare do cover the initial exam. The consultation, the surgery itself, the facility and anesthesia fees are generally bundled and covered under the insurance. When we add LenSx for cataract surgery, there is an additional cost associated with it. At TLC, that is priced here on our screen at $950 an eye. The cost of other lenses can range to much higher. We have surgical counselors that usually do counsel on the costs, And as such, it's helpful for us because, generally speaking, we are removed from that situation. And then finally, depending on your lens choice, you can choose a premium lens or the standard lens covered by insurance. And premium lens ranges can go anywhere from $845 to $1,250 an eye. Again, most of the time these are out-of-pocket costs, and TLC does have financing programs to help patients if so needed. Thanks very much for participating and spending your evening with us at this webinar. And please be sure to visit our website, and it has further educational videos as well as testimonials. There is a phone number on the bottom of the screen, 877-852-8463, in which you can actually schedule an exam and a consultation. And so I appreciate your time.